Hi everyone, and welcome back to my channel. Today, we're diving into a crucial topic for expecting mothers. That is oligohydramnios. I want you to grab a pen and paper and take notes. And be sure to give your full, undivided attention to this topic. In this video, you will be learning about the meaning of oligohydramnios, the pathophysiology, the causes, how to diagnose it, and the management. I have linked few resources from trustable sources below in the description. You can read them for more information after watching this video. Before delving into the condition, let us first understand the normal physiology. Normally, during pregnancy, the fetus floats in fluid known as the amniotic fluid. The amniotic fluid is essential for fetus development. It cushions the fetus, allows for movement, and helps with lung development. What is the composition of amniotic fluid? I was asked this particular question in my third year as a medical student. The amniotic fluid is primarily made up of fetal urine, with smaller contributions from the placenta and fetal secretions. The cycle of amniotic fluid occurs in 3 steps. Step 1 is when the fetus swallows the amniotic fluid. Step 2 is when the fetus processes the amniotic fluid. Step 3 is when the fetus passes out the amniotic fluid in the form of urine. All the 3 steps are repeated. In normal circumstances, amniotic fluid increases steadily until about 33 weeks, plateaus until 38 weeks, and then it declines. So, at term, you'd expect around 500 to 800 milliliters of amniotic fluid. What is oligohydramnios? Oligohydramnios is defined as the amniotic fluid index which falls below the 5th percentile for gestational age. The important keyword is below than 5th percentile for gestational age. Now, let us understand the pathophysiology. Remember the cycle that we discussed earlier? Problems in this cycle can lead to too little or too much fluid. So, what causes this decrease in fluid? Here are the main culprits. The most common is a condition known as premature rupture of membranes, and the other cause is placental insufficiency. In premature rupture of membranes, the membranes break before labor even begins. This leads to leaking of amniotic fluid. Even a small leak can lead to oligohydramnios. Think of it like a water-filled balloon with a small hole. What do you think would happen to the level of water inside the balloon? Let us discuss about placental insufficiency. What does it mean? It means the placenta isn't functioning optimally, leading to reduced blood flow to the baby's kidneys and decreased urine production. Remember that the amniotic fluid is mostly made up of fetal urine? So, if there is decreased urine output, there will be decreased amniotic fluid. Fetal kidney problems is another cause of oligohydramnios. Conditions like renal agenesis, also known as Potter's syndrome, non-functioning kidneys, or obstructive uropathy can prevent the fetus from producing enough urine. To remember the examples of fetal kidney problems, you can use the mnemonic really nice oranges, where the first letter represents the condition. Other causes like genetic or chromosomal abnormalities and even viral infections can also contribute to oligohydramnios. You can use this mnemonic to remember the causes. The mnemonic is poor patients rarely need outside growth very much. The first letter represents the cause that we have discussed earlier. How to diagnose oligohydramnios. As usual, every diagnosis starts from taking proper history, doing clinical examination, and finally confirming via investigation. If oligohydramnios is suspected, taking a proper, detailed history regarding leaking fluid or unusual dampness is the first important step. History is always succeeded by performing a proper physical examination, measuring fundal height and performing a speculum exam. Comment down below if you know what is the rationale of performing a speculum examination. Physical examination is then succeeded by doing relevant investigation like an ultrasound. What do doctors look for in ultrasound? In ultrasound, the doctors are checking the amniotic fluid volume, fetal abnormalities, and fetal size. Doppler scans may also be used to assess placental function. Using ultrasound, doctors can measure the amniotic fluid using 2 methods, the amniotic fluid index or the maximum pool depth. Between these 2 methods, the AFI is more commonly used. AFI involves measuring the deepest pockets of fluid in 4 quadrants of your uterus and adding them together. Comment down below if you how to measure MPD. In some cases, genetic testing may be recommended, especially with early or unexplained oligohydramnios. There are also tests for ruptured membranes. If a leak is suspected, tests for IGF-BP1 or PMG1 can confirm it. IGF-BP1 stands for insulin-like growth factor binding protein 1. PMG1 stands for placental alpha-microglobulin 1. These proteins are found in amniotic fluid, and if detected, strongly suggest membrane rupture. Next, we will discuss about the management of oligohydramnios. Remember this golden rule of thumb. Treatment depends heavily on the underlying cause. The 2 most common causes are rupture of the membranes and placental insufficiency. I will run through the management of these 2 conditions. Let us say the cause is premature rupture of membrane. If your water has broken, labor often starts within 24 to 48 hours. If the labor doesn't start automatically, induction of labor should be considered. Don't forget to give antibiotics to prevent ascending infection. If the cause is placental insufficiency, management is often delivery of the fetus. However, the delivery timing depends on fetal growth, Doppler scans, and cardiotocography. These babies may need to be delivered before 36 to 37 weeks. Remember that oligohydramnios in the 2nd trimester carries a higher risk of complications, including premature delivery and lung problems for the baby. Placental insufficiency also increases the risk of preterm birth. Additionally, low fluid can restrict fetal movement, potentially leading to muscle contractures which may lead to disability despite physiotherapy after birth. In summary, oligohydramnios means low amniotic fluid, below the 5th percentile. The common causes include ruptured membranes and placental insufficiency. Prognosis is linked to gestation at diagnosis and likely development of pulmonary hypoplasia and premature delivery. Management focuses on optimizing the timing of delivery. That's all for this video. As usual, please give a thumbs up, comment, and subscribe if you find this video useful, as this will motivate me into doing more videos like this. There are awesome medical notes that linked below in the description. Don't forget you can request your biology or medicine topics via the Google form that is linked in the description below. Thank you and see you all in the next video.